So as I said, today we are going to talk about breast augmentation, and let us directly get to the topic. It is a plastic surgical procedure which is undertaken at a qualified center by a qualified board certified plastic surgeon after his various training schedules, wherein we try to enlarge the size of an existing breast, and this is generally done for indications like small breasts or unbalanced breast size, or even after a post mastectomy, that is post cancer resection surgery, wherein you can augment a breast size or reconstruct a breast by using implants. So this is also a part of breast augmentation surgery. And as we know, a breast in a lady, because there are a lot of changes which occur to the breast. They happen because of either age, genetics, pregnancy, weight changes, or gravity. These are generally not under the control of a lady, which causes her extreme discomfort, causes her to feel quite low, many a times affects the self-esteem of a lady, and a surgery, a simple surgery in the form of a breast augmentation surgery, can bring her confidence back up and make her feel more connected with the society at large. This is a surgical procedure wherein in the first consultation we meet the client, we understand her problems, and we take her through the whole journey of explaining how we undergo and how we do a breast augmentation surgery. The most important parts of the surgery are the pre-op counseling, which is true for all the surgeries, wherein we spend at least half an hour to 1 hour explaining her the various options she has after examining her, and talk to her about the various implants available, various sizes available, which would be good for her, which would suit her the best, what are her preferences. We take all these into account. There are various scientific calculations as well, like the high five Tibets calculations and lot other calculations which we actually undertake before we decide upon embarking upon the surgery and deciding which implant needs to fit in, which implant needs to be chosen for the lady. And we at Luxor Hospital generally use the best implants in the world, either the Sebin from France or Eurosilicon, Mentor, or Nago. And there are various type of implants available. There is a silicone implant, there is a saline implant, wherein both of them have a cover of silicone, but the content inside differs. Then there are anatomic implants, there are round implants, then the surface texture is also different. There are smooth implants, there are textured implants, and the lately introduced nano textured implants. We take them through the whole journey of explaining which is good for them, which is the best, which is the latest, and which would give them the best result without any of the risks or complications involved. What else? So we also tell them how do we insert the implants and which are the various pockets wherein an implant goes. So in breast augmentation surgery, generally the implant either sits under the breast, which is either subglandular, or under the fascia, which is subpectoral fascia, or under the muscle, which is subpectoral. Under the muscle, it can either be completely under the muscle, or it can be what is known as a dual plane, wherein it is partially under the muscle. And we discuss all these things with the client, what are the advantages, disadvantages, what would suit her the best, and then accordingly we take a decision in consideration with her wishes, of course. And the various incisions through which breast augmentation can be done are also discussed. It can either be a peri-areolar. There is on the breast, there is the nipple. Surrounding the nipple, there is this brown area which is known as the areola. So we can make an incision, a peri-areolar incision. We can go through that. We can either go through an inframammary under the breast incision, or we can go through a transaxillary, an incision in the armpit, or also transumbilical, through the umbilicus has also been described. and we give her the various options, and then we guide her what we think is the best for her according to our experience as well, and we proceed. The implants are generally inserted either by a finger or a funnel, Keller's funnel. There are two options in that. We generally tend to use silicone implants, and we don't use saline implants so much. We use silicone implants, round implants more of, and textured, non-textured, depending upon the patient preference and discussions with her. So basically, breast implant or breast augmentation surgery is a daycare surgery. We do the surgery in the morning, the patient rests in the afternoon, and 99% of the times, or I would say in all cases, the patient gets discharged on the same day. The incision is sutured using absorbable stitches, so you don't need to come back for stitch removal, or there are no drains as such. There is a very simple dressing, firm compression dressing, which we do over the breast, which is generally removed within 48 hours. A patient can go back to doing all her normal activities right from the same day. We encourage her to lift up her hands, do very gentle exercises right from the same night, and she can start gradually increasing her day-to-day routine from the next day. All her routine activities can be started from the next day, and we prefer to not do heavy lifting for at least around 3 to 4 weeks, following which she can start even her routine gym activities, a little bit of heavy gym activities. Yes, I guess this is in a gist coverage of breast augmentation surgery. I just look at the pointers if there are anything which is important which I have left. Yeah, also the surgical time is around 1 to 2 hours, so it's not a very long surgery. We do it under general anesthesia, so the patient is absolutely comfortable. She won't have any pain except for the IV infusion, which is done before the surgery by the anesthetist. And yes, I guess we have finished most of the important topics which we wanted to discuss. And okay, so I guess I'm able to see one question here. It is by Miss Anjali, and she is wanting to ask, how do you decide which implant to choose for a lady? Yeah, so this is a very important question, and which is where the counseling, the pre-operative counseling comes into picture a lot. We tend to make her comfortable and encourage her to ask all her doubts, all her questions, and depending upon her lifestyle, her body contours, as well as her existing breast size. These are the three things which we take into consideration, as well as the actual physical examination, wherein we look at the breast width, which is the most important thing, the anterior skin pull stretch, second thing, as well as how much breast tissue does the lady have. Depending upon all these things, we generally tend to help our clients decide on what volume would be good for her. We also take into consideration how much cup size she wants to go above, how much cup size she wants to increase. So if she's a 32B and if she wants to go to 32D or E, depending upon that, we increase the volume in the implant and help her choose the implant. So this is how we do that in consideration with the lady. Thank you, Ms. Anjali, for the question. So Ms. Mauli is asking me that, are there any kind of side effects of the surgery, or is it just a myth? So yeah, this again is a very good question. What I generally tell my clients is that be very careful in choosing a board certified plastic surgeon. Be very careful in choosing a good hospital, not a clinic setup. It needs to be a proper hospital setup which has all the emergency handling measures, apart from a very well state of art operation theater. And then if you go to such a place, and if you go ahead and you talk and have a nice consultation with your surgeon, get all your doubts sorted out, and if you think then all the things are going proper, everything has been answered fine, you go ahead with the surgery. There are no major side effects in the sense which cause a lot of problems, and all the risk factors, side effects, etc. would be discussed in detail by a board certified board certified plastic surgeon with you. So I don't think there is anything to worry about. Yeah, so Ms. Anjali is thanking us. Thank you so much, Anjali, for your question, which would help people out there at large. And so I guess we would like to end our session here. We would encourage you guys to come up with questions which you have in your mind, which you have not been able to take part at present, or you are not able to ask directly as of now. What you can do is you can write to us. You can call us at Luxor Hospital, Baroda, Gujarat, and we would be glad to take all your questions and we'd reply you back individually. Thanks a lot. I would be seeing you guys in our next video session soon, and thank you.